So I want to welcome you to the closing session. For those of you who were last year, how many of you were here last year and talked about this? Okay. So first of all, there's no crying in informatics. So no more, oh, I'm sorry, I don't want to go into informatics because it's too scary, or radiology. All right. We're all in this together. I want to start off saying I don't believe there are any bad guys or good guys on this, although sometimes this topic can get pretty emotional. But I think it's important to have this session very interactive. We're very, very fortunate to have folks that I really respect that hopefully span the space of this discussion. I want to introduce, for those of you who probably don't need a discussion, we have Dr. Rain Geis from Advanced Medical Imaging Consultants. We have Dr. Steve Ori from the University of Pennsylvania. Who's next? Elliot? Okay, we have Elliot Siegel from the University of Maryland. We have Dr. William Keyes from Inland Imaging, and we have Rich Wiggins from the University of Utah. But more importantly, we have all of you. And we really, I think the fun part of last year's session was getting interaction. So we're going to try, and I know that you know for me it's really hard, to try to limit our comments about this topic. I'm going to start off, though. You're going to have to put up with one more rant for me, because I want to try to define this for those of you who were not there last year, to define what we're talking about. Because if anything, the session that we talked about last year, the concerns we raised last year have become even more significant and actually now have raised to the general zeitgeist, the general perception of general radiologists that don't know PACS from a hole in the head. People are actually quite concerned about this concept. So what we're going to be talking about today, as I said, we all are going to discuss, is this concept of value innovation through imaging informatics, which was really, to me, the positive twist on this concept of commoditization versus value in a flattened world where the technology we all live by, the reason why we're here at SIIM, the propagation, the enhancement, the improvement of electronic-based image management and transmission and consumption. This is what we live for. This is why we're here, has actually been the enabling technology for commoditization and potentially a race to the bottom, which is a scary thing for a lot of folks. And so where we want to go is that, first of all, is that a fair accusation? Remember I talked about in the opening session, my dad, a retired radiologist, saying, you ruined radiology. Is that a fair accusation to us in IT? And what can we do to turn it around? My perspective is that IT, it's a weapon. It's like anything else. So as arms dealers, what can we do to help facilitate folks who don't want to commoditize? Or maybe commoditization is an okay thing, because remember, we like commoditization when it makes our PCs and our iPads cheap. It's only when you start outsourcing us that we get really worried. So I want to frame this with a couple comments. Now, there's no question that one of the reasons why people are getting more concerned about this is that the pot of money is getting smaller. Now, whether or not you support the healthcare reform bill or even consider it health reform, there are some significant consequences to its passing. Certainly, the technical charges that not only are responsible for the financial viability of many radiology departments and imaging centers, but also, and I'm sure you recognize this, is responsible for the financial viability for most hospitals as a whole. That's going to go down significantly. Reimbursements, because of things that I want to get into, will drop anywhere from 15 to 35%. For some places, especially imaging centers, that's bad news. Very, very bad news. I don't want to get into this because that's pretty more physician-centric on this, but again, they're just playing with us on this. And more importantly, at least from the long haul, there's no question that utilization and management self-referral didn't go our way. The basic line that I use. Now, what is the consequence of all these things? The new reality, and this is an important thing. It's an obvious statement, but it's important to understand that reimbursement is going to decrease for everyone, and that's important. That means everyone, the hospital administrator, reimbursements are dropping for everything, hospitals, imaging centers, radiology groups. What that basically means is everyone is out for themselves now, potentially. That normal alliances that were easy to maintain and foster when the times were good and we're living in surplus, sometimes when the well starts getting dry, sometimes your neighbors become competitors. Where certain behaviors where you would look the other way, I don't mind my local radiology group having their own imaging centers. There's plenty to go around. Suddenly now it's, well, wait a minute now, why is that local radiology group actually stealing away my high RVU outpatient reimbursers? You get the idea. Competition is going to increase, and as you know, competition is not just the guys across the street, not just the guys in the other departments, cardiology, endoscopy. We're talking about guys across the world, and this is a challenge. Justification for utilization is clearly going to be more prevalent and probably more onerous. Can we as IT people, vendors in the audience, help us with this to make it less onerous? And the real fear that a lot of us have in radiology is this is all going to be resulting in an encouragement, a facilitation, a pushing towards commoditization. And what I mean by that is there are folks that it would benefit greatly if radiology would be commoditized, and that's important to understand. Now, the question is, what are we as radiology providers or people who use images to provide patient care, what are we trying to do? Can we add value? How do we avoid commoditization? And the argument many people have made, not just for radiology, but any industry subjected to the threat of commoditization or outsourcing is, well, you have to differentiate yourself from a commodity, and that is you have to be a value innovator or provider. And these concepts come from many people, but for those of you who have MBAs, without exception, you'd be familiar with Michael Porter's work. That talk about competitive advantage, that in the modern economy there are two ways to survive. One, sell toilet paper. Two, sell iPods. What do I mean by that? Sell a commodity, an undifferentiated asset. I don't know about you, I don't differentiate toilet paper. The problem is if what you perceive is viewed as just a commodity, there's only one rational criterion by which a consumer will select the vendor. And what's that? Price. Now, what Michael Porter says also, and other folks, is there's another way to compete, and that is provide something that is perceived as a differentiable resource, and that is something that provides value, like an iPod. iPod's an iPod's MP3 player, but no, because of the experience it represents, we are willing to pay a premium for that. And so the question that I will ask is radiology a commodity provider or a value provider? And before you answer that, let me show you this. How many of you are familiar with this? Okay? So basically, for those of you who don't know this is eBay for radiology. All right? Now, I swear I didn't make this up. I love this website. And the reason for it is it actually demonstrates radiology as a commodity. Look at this. Here's the tagline. Get the best price. You don't hear about get the best value, get the best quality, provide real service. No, it is price. So by definition, these guys basically say radiologist commodity. Price is the only thing you should care about. The other thing I love about this is this diagram. So the only thing that's the only person that is differentiable, that has any color, is this person in the center. Who's that? That's the hospital administrator. Look at all the other guys. Gray, faceless, undifferentiated, flattened. It's perfect. It's a perfect metaphor. Okay? Who are these guys? The radiologists. Okay. So before you answer, are we a commodity or a value? We may have our own opinions, but perhaps what's more important, how do other people perceive us? Does it help that most college-educated laypersons don't realize that radiologists are physicians? Not quite sure. Let me show you another one. This is a Wall Street analyst report on, I'm not picking on companies, this is public knowledge. This is a Wall Street analyst report on a particular Nighthawk radiology service. And I just want to emphasize, and again, this group is not saying this. This is an analyst saying, in order for this group to grow as a public company, and for those of us who are investing in them to get our money, the future is in radiology group disintermediation, bypassing the radiology groups and working directly. In other words, turning Nighthawk into Dayhawk. Disintermediation, the elimination, the severing of the relationship, the loyalty or the trust relationship between the local radiology group and the hospital is the key to our success. Okay, so this is not a neutral war here. There are people who it would benefit if radiology is commoditized and interchangeable. How many of you are from Northern California? Okay. Tony, you in the audience? All right, so, okay, all right, you know these guys, right? Okay, this made big news, didn't it?
I knew him.
This made everyone in ACR freaking terrified, okay? So basically, for those of you who aren't from Northern California, is it safe to say, Tony, that the Sutter Health Clinic is a non-trivial healthcare delivery system in Northern California? I trained there. I was at Stanford, and I spent a lot of my rotation at the Palo Alto Medical Clinic. Is it also safe to assume that the Radiology Association of Sacramento is one of the larger radiology groups? Yeah, Bill, do you agree with that?
I worked there for 5 years.
You worked there for 5 years, all right. These aren't little, your mom and pop operation, right? Pretty sophisticated, would you not agree?
They used to be a big group.
That's the point. These guys, was it a Friday of Thanksgiving? The Friday of Thanksgiving of last year, they got their pink slip. A relationship for many years, they got their pink slip. Now, I know these guys. I have a lot of people who I did residency with who work for RAS. I know a lot of people, the Sutter administrators, and I'm going to guarantee you one day they didn't wake up and say, I have nothing on my calendar, what am I going to do? I think I'll sever my relationship with my radiology group. Okay, so that's something to think about before you finish. But the thing that I'm going to close with here is this comment, and that imaging IT, what we do, what we're very proud of, and what we do well, has been the critical enabling technology that has facilitated this perceived outsourcing. Fair enough? And so that's what we're going to talk about today. What is our responsibility? Is this a fair accusation? What can we do as providers of this technology to perhaps provide value and not commoditization, or is it inevitable? I'm going to skip all this stuff because I want to get into the actual meat of this thing. But basically, the kind of questions I want to ask you, and I want our panel to help facilitate this, is the commoditization of radiology inevitable? Because when you look at other industries, including white-collar type professions, engineering, all that, it is extraordinarily rare once you start this trend towards commoditization to ever get away from this. Certainly that's a challenge. We would be an exception if we could stop this. Is it fair to blame us in IT for the flattening of radiology? Or is it our fault as radiologists? How can we in imaging, IT, and informatics help radiology provide value if we want to try to work against this grain? How can we as radiologists re-engineer itself? How can radiology re-engineer itself by leveraging imaging IT? Should we do that, or is it too late? And why should us in the audience who say, it's not my job, I don't care. In fact, those damn radiologists never were nice to me. Maybe the new guys will be. Be careful with your thought about that. Because if we consolidate and provide radiology services, maybe we want to outsource our PACS support and our IT as well. So are we on the same boat, or are we going to start kind of fighting amongst each other? How many vendors do we have still in the room? Or are you all at Hayes team playing golf? Okay, and I really want you to be engaged in this discussion as well. And that is, what is your perspective as the ultimate arms dealer? I used to be one. Do you really care who actually buys your stuff as long as someone's buying your stuff? Is it important to you that radiologists become outsourced, or do they need to be surprised? I'll tell you, I've heard both sides. I've heard vendors that I respect saying, you know what, radiologists are a pain in my rear. I would rather sell my stuff from the hospital administrator and not get them involved, because you know that Steve Orr, he complains a lot. He wants all these features. Elliot wants to do AIM and see a big integration in his packs. Screw that. Sell commodity. I want people who don't know any difference. I want everybody to be outsourced. Is that a fair perspective? Or are you a vendor that says, no, we want to differentiate ourselves, so that means we want a discriminating customer. We want someone who really appreciates what we do. So that, I think, is going to be a fun discussion.